Whooping cough is a bacterial infection of the respiratory system that usually affects children of the age of 1 year to 5 years. This infection occurs from the airborne bacteria called Bordetella pertussis. This disease is highly contagious. The disease spreads quickly. If not taken proper care, it can be very dangerous for small babies. The bacteria invades the nasal passage, respiratory tract, and lungs, which produces thick, sticky mucus discharge. It can spread from person to person. People who have pertussis spread this disease through coughing, sneezing, and breathing close to someone, and sometimes by touching the infected surface and then touching your nose or mouth. Certain home remedies have been beneficial in the treatment of whooping cough. The most effective remedy is the use of garlic. The syrup of garlic should be given in doses of 5 drops to a teaspoon 2 to 3 times a day. It can be given more often if the coughing spells are frequent and violent. Ginger is another very effective remedy for whooping cough. A teaspoon of fresh ginger juice mixed with a cup of fenugreek decoction and honey to taste is an excellent diaphoretic. It acts as an expectorant in this disease. A syrup prepared by mixing a teaspoon of fresh radish juice with equal amount of honey and a little rock salt is beneficial in such conditions. This syrup can be given thrice a day. Almond oil is also good in cases of whooping cough. 10 drops of this oil should be mixed with 10 drops of fresh white onion juice with 10 drops of ginger juice. This mixture of juice should be given 3 times a day for 14 to 15 days. The herb calamus, called vach, is another valuable remedy for whooping cough. This herb is antispasmodic and therefore it prevents severe bouts of cough. If the patient is suffering from constipation, a mild laxative, preferably castor oil, should be given to the patient. This may relieve the pain in the abdominal muscles. The patient should be protected against the exposure of cold and moisture as it may aggravate the condition. At times, whooping cough can be very serious and the patient may require treatment in the hospital. Usually, in the hospitals, treatment for whooping cough is antibiotics. Yes, early treatment of this disease is advised as it will be good for the patient as well as it will help in preventing spreading of the disease to others. If you are sick for more than 3 weeks' time, the treatment in the beginning may not be that effective because by this time the bacteria have already done the damage to your body. To keep yourself away from whooping cough, the best is to vaccinate yourself. The vaccines for whooping cough is DTAP and TDAP. These vaccines may also provide protection against tetanus and diphtheria. Should wash your hands often with soap and water. Should avoid touching your face with unwashed hands. One should cover their face while coughing and sneezing. Should stay at home when sick. Should avoid such people who are sick. This was all for today. Please subscribe the channel. Thank you for joining.